Interestingly, I was just saying before we joined the call that we'd had an email from someone who was interested to hear the perspective of a man, because I think, as your study showed, 90% of carers in the rare disease space are female, across that survey. So I'm really interested to know, James, as a male taking on this role, what support, if any, has been available to you? Um, I'm assuming it's more difficult for you to find men that are in that role that you can perhaps connect with and relate to. But what has been your experience in terms of accessing support if you've needed it?
Um, yeah, so I suppose, in terms of sort of professional support, I haven't felt the need, to be honest, to access any of that. But I mean, in terms of sort of it being a man in that role, I suppose, I mean, I've never been a female in the role, so I'm not sure how they feel like that. But being a man in the role, I suppose people, some people, friends and acquaintances or colleagues, sometimes don't quite understand it. As I said that earlier on, where it's oh, how was your holiday, and people just assume that you're taking the mick a little bit.
Mm.
But I mean, I suppose, yeah, professional support, I haven't really found that I'd needed it. I mean, in terms of friends and family, um, I think we both have pretty good families that understand. My family, we live close to Celia's family, but my family live 150 odd miles away. But I suppose, yeah, people check in and ask about it and see. I mean, some friends, I suppose you learn that, some friends are much better at it than others, to checking in and seeing how you are, or, realizing when they're speaking to you that you're having a bit of trouble at the moment. And it's surprising, you think it's surprising that some friends that I have that you think that do it quite a lot and have come out of the woodwork to be then really, really close friends with us. Yeah. So yeah, I suppose it as I said, in terms of support, I mean, I'm not 100% sure what is available, just purely because I haven't looked, but nothing I suppose has been offered by any sort of health professional or anything like that that I'm aware of.
And
No.
you mentioned something there,
No.
Wes, which I think was really important. You said about people saying about concerns they would have if something happened to them or they weren't there anymore. And I know, James, you had a recent experience where you actually had an injury and a hospitalization. So what kind of goes through your mind in that situation where suddenly you're the one that needs a bit of help and a bit of care? How does that work when it's got to be flipped around? And what's your anxieties and worries around that?
Yeah, I suppose, not just if something medical happens, but also if I have to just be away, for work. Or there was about a year ago, I was away for a week and a half in London, and working from 5 a.m. to 11 p.m. sometimes, and just and then obviously you worry hugely, and I think Celia sort of tries to shield me if things are going wrong as well a little bit in that time. But being so close, you can often tell. So there's something's up. But I mean, Celia's also a very good caregiver, and so she loves it too. And yeah, she's always very good. And if I've been ill or off my feet for a while, herself and family as well. Again, it comes back to relying on a network probably more than other people do.
Is
Um,
that nice for you,
Yeah.
Celia? Because there's an element of kind of redressing the balance a bit. Like, do you quite like that to be able to give something back in that way?
What, the power play?
Yeah,
Yeah, the power shift
not in so
back
many
from.
words, but yes.
It's I think for us, like the question of, what if James died? I think, that is something that we are going to, one of us is going to go to bed. Likely it's going to be me. But if it isn't me, what am I going to do? And I think it's almost like there's many people in our marriage. It's not just us, and we're very lucky. The fact that I'm very close with my mum and dad, and I have some amazing friends that message me every day saying, "If you need anything, let me know. I'm here." And James has amazing friends. If we didn't have that, I don't think we'd be in as good quote as a situation we are in now. It's almost like my best friend always says, she actually said in her maid of honor speech that she's marrying the pair of us, not just
Oh,
me, because there is that kind of different relationship you have with people. Even though I'm 27 years old, the relationship I have with my parents is probably much closer, and it's a very different dynamic than people my age tend to have with their parents. if we didn't have those people, it would be a lot more difficult. And like James said, we've both been very fortunate in the fact that James hasn't had to ask for professional help because we already have that massive network that can step in. But without those people, it'd be very difficult. You know, when James was talking about going to London for a week and a half, I went to stay at my mum. But you know, if we didn't have that, we really would probably question what we were going to do, because I know there is that anxiety of I can't leave her alone for too long. You know, it's almost like got to let the dog out for a wee, but it's the reality of the situation. And surrounding yourself with as many people as possible. And what's really unfortunate, you know, speaking from a UK perspective, is that the care system is not there to back people up when they need it. And especially if you have kind of an illness on the level that I have, where it affects every single element of my life. I can't eat, I can't go to restaurants, you can't, you know, go on a whim on a holiday, like Wes was saying, all of those things we cannot do. But I'm able to have that level of autonomy, which cuts me out from being able to access any kind of support. So it falls on James. And because James works and I'm a disabled person that works, it then cuts us out from James being a recognised carer because of the hours. Things like that in the UK system make things very, very difficult in being able to access support. But if somebody who did those assessments took a deep dive lens on our lives, you know, James spends however many hours a day, like I was saying, helping me, looking after me, and those get, you know, more extreme depending on the situation, that we live our lives as a patient and a carer, but to the outside world, we don't look like that. So it's very difficult for us to be able to access anything. I remember when I was trained to use my own Hickman line at home, I had a nurse that would come in and give me respite one day a week. So she would do it on a Friday. The funding got cut and that got taken away from me. And James is not very good with fiddly stuff. And I remember he was standing over her watching the nurse and he was like, I'm never going to learn how to do this. I actually can't do this. And I'm too scared to give you sepsis. That are you okay if I don't do this? And I said, this is fine. I'll do this on my own.
I actually couldn't get the gloves on. I tried 100 times and could not do it in a
the first hurdle.
in a clinical way.
Even
exactly.
Even that, it's, you know, if I break my arm and I can't do my blood infusions anymore, I'm going to have to go into a hospital until my arm recovers, because we don't technically qualify as patient and carer. So that is a really, really terrifying thought about, you know, just having that injury could make things very, very different for us. Yeah.
Well, that's frustrating, isn't it? Because what they're not seeing is that, you know, James is at 1 a.m. on the laptop catching up with work and doing things around that to adjust his time. You know, that's the side of it that's not not reflected. So I see we've got quite a lot of questions which I want to try and get to. So I want to kind of come back to you, Wes, before I then go to a final sort of sum up from us all. In terms of support, was there anything from the work that you did that highlighted what sort of support? And then Celia's given some examples of things that would make a difference to her. Was there anything that was shared in those sort of responses as to what support would have made a difference to people?
Yeah, so we asked them where they did get support, and then what would make their caring easier. And it's funny, what James said fits into our survey, where only a third of the people said they've gone to professionals for support. Virtually everybody goes to family and friends, right? That was the largest ones. I guess that makes sense. Social media is half the people. And then patient advocacy groups is also, so shout out to patient advocacy groups to, you know, for people to remember that they're there to help, and how can they help, because, you know, they're made up of a lot of the same folks. But when we said what could make things easier, so much of it does get to financial support. I mean, again, because we heard how it affected people financially, but people said financial support, more money, financial assistance. Again, folks with kids were saying school healthcare providers and regular healthcare providers to be more knowledgeable, because, you know, a school nurse doesn't know about a rare disease, right? More societal support and understanding of the role of caregivers, somebody said. More understanding from the people around us, just that whole, you know, how one of the objectives of most patient advocacy groups is to raise awareness, right? Because to get more of that, of course, 7,000 rare diseases, I always think it's overload of awareness if we but I don't know what else to do. But the key thing is, and here's a quote from one, and they said it in so many different ways: the ability to have a break, but have the patient with a knowledgeable, qualified individuals. They have to get away from 24/7, but they can't leave their patient in worse hands. So how to do that, and that's I don't know how, is that a government solution? Is it I don't know what it is. Certainly we don't have it in the US, and you're talking about funds being cut in the UK. Another thing that comes up a bit with teens transitioning to adults, easier to navigate the transition to adult services, because you're a caregiver to a child and then the child becomes an adult and a lot of the support disappears, yet they need it. And there's a whole, you could do a whole session on that, because I know it's a huge issue. I guess one more I'll mention. It had to do with the physicians and the doctors. Doctors willing to collaborate with each other outside their specialty to offer the best care and learn from each other. Another, more specialists knowledgeable about the disease. Physicians that will accept they don't know everything, because that's what people are running into. So the whole medical community, they could be more helpful. And people, praise them to the help for what they did get, but these were areas where they, would help their lives immensely if they, could work more as a team and know more about their diseases.
I completely agree with that. Our lives would be so much easier if, when we went to a doctor, we knew that we were going to get a doctor that understood and didn't send us away for 6 months to tell us to come back to someone else, and you just end up stuck in that cycle, and things get worse and things take longer because you just can't find people that understand and get it, and that takes a massive stress off if it was able to do that. If you knew that when you went to a doctor, they were going to help. Yeah.
Well, that takes us back to full circle, really, with where you started, Wes, with that burden of being that constantly having to repeat yourself and not being believed as two of the biggest impacts, and that's, that sums it up really perfectly. I want to kind of put a final thing to you before we go to the questions, and I'll come to you first, Celia. Thinking about what would be sort of a single, or maybe your sort of top 2 things as to what you think would make a difference on the impact of life of carers. And I know you've alluded to some of the things there in terms of having that sort of professional help to support with some of the day-to-day things. What would be your top thing that if you could see something happen to help carers, what would that be?
I think the first thing would be kind of based on what Wes just said about the medical profession, understanding. And 99% of the time when I go to my doctors and either James has driven me or we're away from goodbye and I'm going with my mum or whatever, and he goes, good luck, and I'm like, there's no point because nothing's gonna happen. It's very frustrating not being able to access what we need to access, not being able to access specialists, or having huge waiting lists. So things get worse in the meantime. And physically I'm dealing with that, but also James is as well. And that unpredictable nature, and knowing that when something goes wrong and we go to A&E, 99% of the time that A&E doctor does not understand Loeys-Dietz syndrome and does not know how to help. And then James has to step in and start advocating, and that is very difficult. And I think the other thing about making carers' lives easier, especially from the experiences that James and I have had, I know I touched on kind of being able to have respite and that medical support at home if it was needed, is around trust of carers and understanding the fact that I want James's voice to be treated with the same validity that as the patient, my voice is treated. So if James tells you something, I carry around bits of paper that say, do not touch my central line, do not touch that tube, do not give me this, do not give me that. They don't listen to James. They never do. And I think there has to be this level of understanding from the medical profession, from the emergency services, from social care, whoever it may be, that the 2 people that know the most about this in this room right now are myself and my husband. And he knows just as much as I do, if not more, from a different perspective, that his voice is not listened to with really any more autonomy. And that's very frustrating because I can't advocate for myself. So nobody is allowed to advocate for me, kind of seems to be the general principle. And that can be incredibly frustrating. I remember during COVID when I got really ill and the feeding tube that I did have stopped working and I kept vomiting it up, unfortunately. And James kept ringing the hospital saying, she needs some fluids, you need to give her something because she's had nothing for 5 days. And they just wouldn't listen to him. And I was not in a position to be able to talk and advocate for myself while I was in intensive care, and they just didn't listen to him at all. And so that I think would have a massive impact, knowing that when James comes to A&E with me and said, you need to give her a cannula because she can't have pills, you're going to have to do it by IV. And 2 hours later, and the nurse comes around and says, oh, did you ask for a cannula? It can be very frustrating. Very
Absolutely.
frustrating.
Yeah, and James, coming to you, what would be your perspective on kind of if there was one thing in a magic wand that you think would make things easier from your perspective, or for others that you know that are in the situation of being a carer?
I think it would be pretty much the same as Celia's actually. You know, it's and also having a bit more of a streamlined healthcare system. Like I think Wes mentioned, you know, it's when I think it's fine if it's a simple thing and you know you break your arm and there's a process. It's a process driven treatment. When it's not, and multiple people from multiple different hospitals have to speak with each other because you know a hospital in London's the only one with the equipment to test something with for Celia, and then you know it just really overcomplicates it. And it means that you know not only the time spent where you're just calling around all these people asking if they've spoken to the other person. Yeah, I'd say that just more streamlining in the system really. And you know it must be incredibly difficult for you know some of these doctors and things to, you know, they can't know everything, but you know half the issue is that you know you speak to one person about it, you explain it, they research it, they put a proposal forward, and then you speak to the next time you go and you speak to somebody else and they do the same thing and they're sending it, but they're sending it to each other. They're not, there's no singular person that's going, okay, well, let's do this, which is very frustrating at times. Yeah, so I'd say that just a little bit better streamlining for these complicated cases. Yeah.
Was there a trend, Wes, from the survey as to anything when people were filling out kind of the long range questions as to what would have made the biggest singular difference to them?
Well, in terms of caring, back to the I need a break, but I need a competent person to. I can't just run off and leave it. You know, a babysitter that doesn't know, whatever it might be. Because one of the things that we also said the impact people have was it was affecting their own health. Well, not a surprise, right? You have to take care of yourself as well. And so that's if I had to pick the single biggest thing that came, because you know we're focusing on the caring, was yeah, if I need a break, but I need competent people to fill in for me that I trust 100%. And that's how do you you may have generally it probably amounts to a family member, but does everybody have that? And is a family member available and competent to do that? Or if it's somebody you're paying, there's a whole other financial burden. And where would you find such a person? So
yeah, I mean
that's the, you know, I think that was the highest need.
Yeah. And it's clear that there's such an unmet need here, and you know the burden in terms of kind of these unsung heroes of carers, whether they're you know partners, parents, whatever the situation will be, because of course a lot of those people are also juggling full-time jobs, looking after children, and completely overstretched. And so that element of actually their own health is really important. You know, I think with no real infrastructure to support that, it feels like they're kind of expected to go on to breaking point. You mentioned, I think two of you mentioned about that sort of burnout and how the risk of that, and you know what really can we do to make that better. It's such a difficult thing that's not really being addressed, and I'd love to throw that out to the audience because I can see there's quite a few questions, so I'm going to go to some of those.
And we're talking about a survey of US and UK. We're talking about developed countries that have more resources than many other places, and we can't handle it. I mean, geez, what does that mean for people around the world?
Yeah, absolutely. That's a really important distinction to make for sure. I see someone's asked about the survey results, Wes, and where they can get them. And I know that Becky has put in the chat a link to where you can access that report. So definitely recommend people.
We're happy to send out that. As a matter of fact, we're actually if somebody is a researcher or something, we're happy to send the raw data. It doesn't have any names. It's all anonymized. Of course, we would never compromise that. We're happy to send that data out as well if people want to analyze, like they might want to look at a certain disease or whatever it might be. So the summary slides are available, but as well as the data. So she put an email address there. So please ask, let us know what you're interested in. We're happy to share that and have other people analyze it. Other people often publish get find it and publish. We're happy to do it. Just give us credit for it somewhere. That we're free publicity to spread the word. That's all we ask.
That's wonderful. Thank you, Ed. So someone here said some caregivers may be invisible carers and they don't even realize they're caring. So other family members, siblings, for example. I think that's a really important point to have. You know, a lot of young people particularly don't really recognize that they may be a carer for a parent, you know, in that other way around. Someone else here, what do parents think or feel about their own romantic relationships while caring for a child with a rare disease? And I think that, again, that's a really important question there is, you know, if you're the parent caring, you know, you mentioned, Wes, about people saying about the strain and sometimes failure of a marriage.
Yeah.
For sure, that's felt in parents as well, you know, that kind of difference in just ability to cope with a situation, ability to deal with the demands of that can put an inordinate amount of stress on relationships. So, you know, it's a real thing that for sure.
We had one piece of good news in there because, you know, marriages are difficult enough without all these stresses. So but there were about half people said it helped bring them together as a family. So there is a silver lining there somewhere. You know, people will rise to a crisis. So there is that, but you know, it's hard to rise to a 24/7, 365 crisis. So.
Yeah, well, absolutely.
I'd add to that, just kind of for anybody listening that might be in a similar situation. The quicker we realised that our relationship wasn't like everybody else's, it made things a lot better. Because as the patient, you constantly get the feeling of, how much am I ruining someone else's life? Like he's not, you know, before I met James was off traveling the world in Africa and, you know, in Malaysia and on a motorbike in Italy, just driving around, catching malaria, God knows what he was doing, sailing the world. And I constantly said, you know, he's not doing any of that now, and it's all because of me. It's all because of me. And as soon as I started listening to James and said, but I love you, you know, it's a choice to be here and I want to be here. And I think that's really important to remember, is the fact that I never call James my carer. It's just part of our relationship. It's just how we operate, how we do things. It's just different for us and it will always be different. And trying to stop comparing ourselves and what we're doing in our lives to other people, because some people look at us and they think, oh, we'd love to live in the countryside and, you know, be sat back and relax and have a nice chill life and all this kind of stuff. And we often dwell on the things that we're not doing, that we're supposed to be doing, you know, in our 20s. But the quicker we came to accept the fact that our relationship looks very different from other people's, made it a lot easier to kind of answer some of those questions that were going round and round. I know my head especially.
And I think language matters as well, doesn't it? I think we see a lot of things talking about burden of care as well. And I think the minute you put the word burden into something, it automatically brings a layer of feeling about that, you know, and while unintentional, that sort of language really sits with people, doesn't it? So I think, you know, maybe we need to do a little bit more work around the narrative and the kind of the lexicon that we use when we talk about that kind of care, because for sure, no parent thinks of their child as a burden. And obviously, James does not think of you as a burden, but that's kind of the language that sits with that caring dynamic, doesn't it? Yeah. So I think we need to find some new ways of framing that take that sort of subconscious narrative.
Yeah, and I said before, you know, I've never sort of thought of myself as a carer or called myself a carer or anything like that. It's just being a husband. That was it. And that literally is it. Well, I don't think of it as extra. It just is what it is. And you know, you have to do what you have to do. So, yeah, I've never sort of, and I think that maybe has helped a little bit as well, because, you know, I don't distinguish between, you know, normal husband and wife, or normal as it were, but husband and wife, you know, doing things for each other and what we do for each other. There's no real distinction there. It just, you know, is what it is, and we just crack on and deal with it.
Well, it goes back to what you said there, Celia, about having that, accepting what is your normal, because I think with social media, it's so easy to look at everyone's lives and go, oh, we're not doing this, we're not doing that. But, you know, they all have their own narrative, don't they? And it's not always as it seems. So finding your own acceptance and level is really important. We've got lots of comments here, which I'm not going to get to all of them because obviously we're over time, but I just want to highlight a few here. Just had a thank you for someone for a great webinar. I've said it's really stands out for them, and they thank you all for taking part. Someone that said it's just exhausting, which I think, you know, for sure that's something that a lot of people can relate to that. And somebody here says, both my wife and I deal with chronic illnesses, so trying to work around our illnesses and take a vacation would be a miracle. Dealing with a rare disease is magnitudes more difficult on the Richter scale. Absolutely.
I mean, that there's you know, I'd love to go to some incredible places. And even when we were picking our honeymoon, we literally went, we can't go there because if something goes wrong, we're in big trouble. We can't go there because they won't understand. We can't go there because we know they won't have the facilities. We can't go there because we know if something does go wrong, you know, we're going to be landed $800,000 bill. America. And I saw a comment of somebody saying about how, you know, we are very privileged to live in the UK and have the NHS. And I do not know what position we would be in if we lived somewhere that wasn't the UK and didn't have access to the medical system that we do. So I'm very conscious of the privilege that we have being here in the UK. But, you know, even on our honeymoon, within about a week, we were like, right, we cannot leave Europe because we have a European health card, which means, and that was, you know, how many couples sit there and go, my European health card decided where I went on my honeymoon. Like it's, everything is affected. And there's that kind of, you know, yes, human beings have free will and autonomy, but your rare disease is what governs your life. And it now governs James's life as well. And we just have to come to peace with that and realize we can still have fun and we can do our own things. Like I have a feeding tube, I can't eat. We very rarely go to restaurants, but that, and you know, and I'm very conscious of the fact that James loves his food and I want to still give him that experience. So I always bake, or I do like 3-course meals at home and make it all nice and make it all lovely. We just do things differently, and it doesn't mean, you know, we can't have fun and we can't enjoy ourselves. We just do it a bit differently to everybody else, and
It's
that's
just a bit of a
okay.
cake, isn't it? And you know, maybe you could let him have the goats.
No.
Just saying.
I already
Advocate for you there,
gave him
James.
ducks. I gave him ducks. He's not having goats.
Honestly, thank you both so much. It's been really wonderful talking to you. I really appreciate you being so candid. I know it's a really difficult subject to talk about. So thank you so much for participating. And Wes, you know, for really bringing to life your survey. I think, like you've said, it's available for people to access. And I would encourage people to get in touch to access that, because this can filter into advocacy programs that other charities are doing. You know, it's really important data. Let's not reinvent the wheel. Let's take that information and use it to make things better. Thank you everyone for listening. We've had a great turnout today, and thanks for the questions. I'm sorry we didn't get to all of those in your comments, but we really appreciate those, and we'll go through them and see if there's any we can follow up on. Please feel free to reach out to any of the contacts that will come up at the end screen. And if anyone would like to read more about Celia's story, I think Becky has put in the chat the link to her article. And also we did a survey with Wes and his team on the impact of women carers specifically, which is in our Women in Rare edition, which again is going to be shared in the links, as will the link to the survey. So thank you so much everyone for participating and for listening, and lovely to see you again, Celia and James and Wes.